Good day, future pharmacist! How are you? I hope you are doing well. Welcome to our training program for today. We have a lot of knowledge that we're going to impart to you all about pharmacy. So come on, let us all discover those. But before anything else, may I read to you the objectives of this training. First, we will define pharmacy and pharmacist. Second, we will discuss the different types of pharmacists. 3. To know the characteristics of the pharmacist. Fourth, to learn the different technologies and machines used in a pharmacy setting. And last, to recognize the challenges and ways of pharmacists to cope up in a community setting. And we have a common goal for this training. Our main goal for this training is to educate, train, and inspire pharmacy students, preparing them to become a future pharmacist. So what is a pharmacy? A pharmacy is a place where medications are dispensed and sold. They are retail facilities that sell both prescription and over-the-counter medicines and are overseen by licensed pharmacists. Then what are pharmacists? A pharmacist is also known as a chemist or druggist. Is a healthcare professional who prepares, controls, and distributes medicines and provides advices and instructions to patients on the correct and safe use of medicines to achieve a maximum benefit, minimal side effects, and to avoid drug interactions.
Okay, now let us proceed to the different types of pharmacists. First, we have a community pharmacist. A community pharmacist, often referred as a retail pharmacist or retail drug outlets, is a place where medicines are stored and dispensed, supplied, or sold. Next is specialty drug pharmacist. Specialty pharmacy focuses on high-cost, high-touch medication pharmacy for patients with complex diseases states. And of course, medication in specialty pharmacy range from oral to cutting-edge injectable and biologic products. Another one is a
military pharmacist.
These are the pharmacists who help our soldiers and their families to get the treatment they need through medications and other therapies. If you are a military pharmacist, you'll plan, direct, and evaluate pharmaceutical activities and help ensure your patients are using pharmaceuticals in the safest and most effective way. Next is the clinical pharmacy. Clinical pharmacist is a health science discipline in which pharmacy provides healthcare and optimizes medication therapy and promotes health and disease prevention. Now let us proceed to informatic pharmacist. Pharmacy and pharmacists are pharmacists with a solid background in clinical pharmacy practice. They have the knowledge of pharmacotherapy and extensive working knowledge in clinical information system and drug distribution system, and also one of the common hospital pharmacist. Second to the last is a nuclear pharmacy. It is also known as radiopharmacy. It involves preparation of radioactive materials for patient administration that will be used to diagnose and treat specific disease in nuclear medication. Last but not the least, the research pharmacist. Pharmacy practice research, also known as pharmacy research, is a specialty field within the wider area of health services research, which focuses on examining how and why people access pharmacy service, how much care costs, and what happens to patients as a result of this care. Now that you have a little background, Let's go deeper knowing pharmacy.
Characteristics of being a pharmacist. We have 8 characteristics of being a pharmacist. Number 1 is multitasking. There are few only in the world of professionals who are doing multitasking jobs. One of it is pharmacist. Being a pharmacist, there are a lot of things to do every day. Their tasks are inclusive in their function and promise obligation to fulfill each moment of their work. Aside from multitasking, they are the ones who is liable for any incident of wrong dispensing of drug done by the pharmacy and burden any violation that the drugstore may incur. Their name is at risk all the time, and their professional reputation is prone to suspension or revocation. Second, prioritize duties. The underlying reason for developing prioritization skills for pharmacists is their increasing busyness. This phenomenon is true too in medicine. Providers operate in a complex environment with a multitude of variables impacting their ability to deliver care with finite resources. And systems are needed to assist in the prioritization of important clinical interventions. Third, communicative. Effective communication by pharmacists is essential to improve the use of medications by patients and ensure optimal therapeutic outcomes. Pharmacists can improve patient adherence to drug therapy through appropriate strategies, including patient counseling and education. Next is critical thinking. It is needed in almost every phase of pharmacy practice because pharmacy students need to evaluate claims made in the literature, manage and resolve patients' medication problems, and assess treatment outcomes. Professionalism. Evolving professional knowledge, attitudes, and behavior is a critical step in providing high-quality patient care. Next, adaptability. Adaptability as patient care providers will be key to thriving in a constantly changing environment. The purpose of the pharmacist has and always will be serving patients. Next is diligence. A due diligence will provide you as the buyer with confidence that the price you are paying for your pharmacy reflects the true value of the pharmacy. We will ensure that you are not overpaying and that you are aware of any potential risks involved in the business.
Different technologies or machines used in pharmacy setting. First is the automated dispensing cabinets or ADC. Our computerized drug storage device, ADC allows drugs to be stored and dispensed near the point of care while controlling and tracking the drug distribution. Hospital pharmacies have traditionally provided drugs to the wards through the ward stock system. Second is the carousel automation. It is a medication storage cabinet with rotating shelves used to automate dispensing. Also, the carousel concept allows technicians to retrieve medication from a single location, and the ergonomic design minimizes bending and reaching by picking from waist height, saving both time and frustration during the fulfillment process. Third is the centralized robotic. Centrally located devices designed to automate the entire process of medication dispensing, including medication storage, distribution, restocking, and crediting of unit dose medication. Fourth is the barcoding at the point of care system. It is becoming a standard of care in healthcare information technology and helps improve patient safety by providing access to accurate information on medication errors. A wealth of literature addresses the application of barcode technology in reducing medication errors during medication administration processes. Lastly is the radio frequency or RFID. It is a technology that uses radio waves to automatically track people or object and associate program information with these people or object. This system is composed of a tag, a reader, an antenna, and software. The tag is placed on an individual object, which allows for unique identification. When an RFID tag item is sent through a reader's field of view, a distinct data code is being transmitted.
Are you still there, future pharmacist?
For the last phase of our discussion, I will impart to you the challenges that pharmacists are facing. First is that there are too many disparate resources. To find a centralized, trustworthy, evidence-based resource for drug information and drug interaction is a challenge for pharmacists, as they often have to sift through various books, tools, and other resources to find the drug data that they need. Second, there is an increasing specialty medications. The increase in the specialty medications in the market offered new hope for patients, but they tend to become expensive, require prior authorization, or involve exchanging detailed clinical information between prescribers and pharmacists. Third, there is a demand for multitasking. Dispensing, expanded renal dosing, patient safety screening, medication therapy management, and more led the pharmacists to become busier than ever, and most of them find it hard to balance everything. Fourth, the outdated information across databases. Pharmacists need the latest and evidence-based drug interaction information at their fingertips to ensure accurate and safe prescription recommendations. Resources often do not keep up with newly released drugs, recent drugs, and contraindications, risking patient safety. Next, the human and financial costs of medical error. This is a common challenge for pharmacists because human error is inevitable, especially in a community pharmacy setting. Lastly, the awareness of specific patient population needs, the patient's age, gender, and even history of substance abuse can play a key role when it comes to prescriptions. Pharmacists must know how to handle different types of patients in diverse situations. So, what do you think is the solution to these challenges? Having an access to a single drug information database can help pharmacists save time and potentially reduce adverse events for patients. With the aid of evidence-based drug recommendations, convenient mobile app, patient-specific approach to dosing, and patient education materials will serve as a breakthrough to these challenges that the pharmaceutical industry is currently facing. So, future pharmacists, I hope that we have equipped you with the knowledge that you need to know about the field of pharmacy. It is true that the pharmacy profession is a challenging path, but pharmacists also play a major role in our society that the community needs for a better and healthy living. Thank you so much for listening. We wish you all luck to achieve your desires and dreams in life. Strive for the best, future pharmacists.